February 4, world over, is marked as the International Cancer Day. It is a day set apart by the World Health Organization to remember patients and survivors of cancer. Nigeria is no exception. According to the WHO, cancer is the leading cause of death worldwide, accounting for nearly 10 million deaths in 2020, or nearly 1 in 6 deaths. In Nigeria, the care and treatment of cancer is very expensive and beyond the reach of many. With this year's theme being Close the Care Gap, the Department of Radiotherapy and Oncology at the National Hospital Abuja has put together this town hall meeting with cancer medics, survivors and focus groups.
This country, with a population of about 200 million people, will require about 200 radiotherapy machines. We have less than 10. So you can see the gap is wide, and we really need to do something concerted to be able to close the gap.
Right now, the cancer patients are scattered in various wards, apart from the chemotherapy floor, which we have already opened here. So for routine admission, you may not need to go to surgical ward, and female medical ward or so on. By the time they have diagnosed and you're already with the oncologist, your next admission may be right here.
Every patient who comes for radiotherapy, after they are scanned, will be given this patient manual. It addresses every single thing that has to do with radiotherapy. It's a beautiful document, taking time, well prepared.
With the 3 commonest forms of cancer being breast cancer, cervical cancer and prostate cancer in Nigeria, oncologists say the country is lagging behind in cancer treatment and prevention.
What government can do as a low-hanging fruit is to create comprehensive cancer centers around the country. What we have now are cancer departments in hospitals like ours. So they have the same budget, they have the same everything with any other hospital department. And you know that cancer care is very expensive, the equipment are quite expensive, and maintenance of those equipment are expensive as well.
Drugs that will be produced, that is, will have an NHI's inscription on that particular medications that will be made available. So in that, the drug manufacturing company have agreed to cost down the cost by about 50%. The NHIS will also take a burden share of about 30% of the cost reduction, while the enrollee will pay, that is about 20%. But that is for the highly expensive cancer drugs.
This international awareness, which usually is led by the Union of International Cancer Control, UICC, seeks to inspire prompt action and life-saving treatment and care for all individuals suffering from the disease.
All right, well, for more on this, we're joined by the chairman of the Multi-disciplinary Cancer Team of the National Hospital in Abuja, Dr. Rasaaq Oyesegun. Glad to have you join us, Rasaaq. Let me start from the beginning. How can we possibly cut down the cost of treating cancer? And what's the greatest challenge that cancer patients face?
Thank you very much. The best way to cut down on the cost of cancer treatment is early detection or prevention, largely. A lot of cancer can be prevented, like cervical cancer, breast cancer. They can be prevented by screening. The cervical cancer is one cancer that will have been going on for at least 5 to 10 years before it manifests into full-blown cancer. So if we have policy of doing pap smear or any form of method of examining women, the womb, the neck of the womb. It's not only the pap smear that can be done, but even just visual examination regularly or at intervals will save a lot. So if they are diagnosed or they are picked up at the what we call precancerous stages, they don't need any there are signs, yes. But at that stage, when it's precancerous, there might not be signs. It can only be detected by examination, by screening. The same thing with breast.
And examination would have to happen only if you go to the
Yes,
hospital, to the
yes.
cancer
So
center. But then again, there's a
education.
challenge of cancer centers that are really not there. How many do you have? And we hear that only 3 out of 7 cancer centers have a functional radiotherapy machine.
Screening doesn't have to be done by cancer centers.
Okay.
There are peripheral hospitals, clinics.
You can walk into any hospital.
Yes, you say you want to do this examination. It doesn't have to be. It's done in rural areas. Gynecologists go there with some other scientists. They go there, do this examination, take samples, and take back to the lab to examine. So that's the best way to cut on the cost of treatment.
Let me quote what Bono of a U2 band said. You know, where you live should not determine whether you live or whether you die as far as cancer is concerned. Yes. But the case in Nigeria looks like cancer is still a death sentence. Why is it so?
Well, there are several factors that account for this. First is awareness. A lot of people are not aware of what they're suffering. Education, they're not aware of what they're suffering from. So they run from pillar to post, not necessarily going to hospital at the first time. So a lot of people, a lot of our patients, they come to the hospital as a last resort, at the end stage of the disease. That is the main problem. Yes, when they're about to die, that's when they come to the hospital. And that's at that stage, what we can only offer is what we call palliative treatment, to reduce their symptoms. Yeah. So that is the main problem. Most of our patients don't present at the early stage.
Early stages. In 2021, Rasaaq, an estimated 20 million were diagnosed. Half of those numbers died. The report, like I said, half died. And the report also says, going forward, unfortunately, it's going to rise. It's a bad commentary. And yet it can be treated. Many can be prevented and cured. So how do we change this narrative?
Education is important here. Education and awareness, dissemination of information. There's a lot of misinformation going around on the internet by a lot of people, that cancer is not curable. If you take hot lemon water, it cures cancer. If you take this, there's a lot of misinformation. And so people who are diagnosed with cancer, also poverty is a contributory factor. Yeah. So when people are poor and they have this or that misinformation which are misleading, they tend to say, oh, if that is the case, then I can afford that. I can afford hot water lemon. I can afford fruits. I can afford vegetable. I can abstain from carbohydrates and all that. They start doing that. Meanwhile, the thing keep on growing. Yeah. So a lot of misinformation, and then they don't come to the hospital when it is late. So, and then there are a lot of worship houses that deceive them that, okay, you don't have to go to the hospital. If you believe alone, it's enough. And then they kept on praying about it, and the thing kept on increasing. You ask them, they say they have been in one prayer house or the other all along. So when they come in, it's really bad. So our own peculiar situation is tragic.
Let's talk about that cost of cancer, because you just talked about poverty.
Yes.
The cost of cancer treatment needs to go down. That's what experts like yourself are saying. And you have only 90 oncologists to 100,000 patients in Nigeria. Am I correct with that figure?
Right,
that's really scary. That makes you're just one of the 90.
Yes.
Right? So what's the best approach in, helping, with this issue of the high cost of cancer treatment? Would a public-private partnership work? What are the alternatives?
Yes. Cost of treating cancer is high world over. It's not peculiar to Nigeria, because Nigeria, we don't manufacture the drugs locally. The machines that we use to treat the patient, like we said, few of them, less than 10, we don't manufacture them locally. And if you have to use this machine and be able to amortize them with time, then it cannot be cheap, because the machines are not cheap. So PPP, yes, can come in. Government is doing its best, but all these are definitely not enough. Like what I mean by the government is doing its best. You mentioned the multidisciplinary team, which is a prerequisite for what was set up by the Federal Ministry of Health to assist cancer patients, especially those with breast, cervix, and prostate, for a start. Because these three combined constitute about half of the burden,
cancer,
the cancer burden in the country. So government is providing fund, set aside some fund for them to assist them. It might not be enough, but they are in the process of releasing this fund to assist this patient. But I mean, the PPP will come in. I mean, and there are so many other pharmaceutical companies that are offering assistance.
The challenge now will be how to involve them. That might be what we'll be talking about here. But what has inequalities and inequities of the world got to do with this worsening narrative I just painted, that comprehensive treatment is available only in 15% of the low-income countries,
yes,
as against 90% of the high-income countries?
Yes, it's unfortunate it's like that. And the highest burden is found in countries that have access to less than 5% of the world wealth. So it's really gloomy. So, and it doesn't look like there's not anything we can do immediately to address that situation. So government effort, private partnership effort is the solution, is the way to go. Companies, pharmaceutical companies and other companies, people investing in cancer.
What is WHO doing about this particular inequalities? Because it's, like they say, I mean, during COVID, some are still in COVID, we're not got out of it fully.
Yes, yes.
That when one person is sick, the whole world, I mean, it's not safe, you know. So, I mean, organizations like WHO, you'd expect them to treat this particular case of inequities and inequalities and try to balance things out, even though that's not the case even in COVID-19.
Yes, so the problem is enormous. It's so enormous that WHO cannot come in, do the detailed thing for each and every country that needs assistance. They provide logistics, they provide supports and other things. They provide funds at times, but they cannot buy machines for you. They provide logistics. They could provide logistics by way of how some of the organs, how you can buy it cheap if you approach them and all that. They could do that, making it leveraging their influence to enable you get some of these machines in a cheap form through companies that manufactures them. Yes, they do this, they could do this, but they cannot individually give every country all the money that is needed to buy machines.
Are there success stories that we can take away, not to depress people too much?
Oh yes, there are many success stories.
Okay, give us one or two if you can.
For example, the first patient that is treated in National Hospital in 2000 for cervical cancer is alive up to today.
That's good.
And there are so many people who have, the important thing is early diagnosis. Yeah. If people come early and they seek treatment promptly, a lot of cancers are curable. But the big thing, the big problem we have here is late presentation because of a lot of misinformation and poverty. And then most of them, 80% of our patients present very late, at which stage there's not much any doctor can do.
Thank you so much, Dr. Rasaaq Oyesegun, consultant radiation and clinical oncologist right here in Abuja at the National Hospital.